We often talk about pharmaceutical innovation in terms of molecule or clinical results. But what actually makes a treatment last for weeks or months with a single injection? That's where formulation comes in. Welcome to Inside Medincell, the podcast series where we go behind the scenes of long-acting innovation right here in our Montpellier headquarters. Today, I'm joined by Emma Sergo, who leads one of our formulation teams and plays a key role in turning scientific ideas into real long-acting treatments for patients. Welcome, Emma. Thanks for being with us. To start simply, and just so our viewers know who you are as well, can you briefly tell us about your background, your role at Medincell, and what your team is responsible for?
So I'm a pharmacist by training. I worked in big pharma, but also formulation CROs. Here at Medincell, I'm leading one of the teams, formulation teams, that is responsible of generating formulations, so long-acting injectable formulations, with our very own technology, our BEPO, and we make products that change lives.
What are the competencies within the formulation team?
So the team is composed of scientists and technicians. They have really different scientific backgrounds, which is fantastic because they have a synergy in the knowledge they have, the knowledge that they can share. They are problem solvers, so they like challenges. And this is where innovation comes, because in formulation you need to have a rigor, you need to know what your timelines are and how to deliver it fast, but you also need to have creativity and imagination. So their day-to-day job is actually quite hard, and from where I'm standing, they're rock stars.
What does the formulation team do exactly at Medincell in particular?
You can imagine it very simply as the drug being your ingredient, and formulation is the recipe. You can have the best ingredients in the world, but if you are not mastering your recipe, if you don't know the quantities between your ingredients, and if you don't know at which temperature you need to set your oven, but the result is lacking, it can be really bad. So this is the power of formulation. The question is not only can the drug perform, we know it can, but can it deliver over a long period of time exactly the right amount that it's needed day by day?
At what point does formulation comes into a project, and why is it such a critical step for long-acting injectables?
So we are in the project right from the start. So the decision that we make really early on are going to impact the product that we are going to have at the end. The adherence of the patients, because when we start, we directly think of what the product is going to look like. It's important for the patients to find themselves in the product. It needs to help their daily life. It's thinking about where the formulation is going to be used, what the adherence is going to be. Is the drug going to be prescribed because the doctors are going to see the use of it? Are the patients going to like it?
If we are very concrete, when Medincell starts a new project, what are the first things that your team start working on?
So in formulation, we start with what we call the TPP, target product profile. It means what the drug is, what the duration is, what the dose will be in the final product. Once we have all this data, we check the drug itself, what are the physicochemical characteristics of the drug. And then really soon we move into the lab because we want to see what happens in reality when we start mixing our ingredients. So one of our main components is of our formulation. It's our copolymers, our BEPO copolymers. So we are checking the compatibility between the drug and these copolymers. We have a big library that goes from linear copolymers, star copolymers, and then maybe any further copolymers that are in the development. And so we are checking the stability. We are checking does it mix well, and in the end we are checking does the product behave as it should or is as we are expecting it to.
Now that we know all the steps, the main steps of the process, are there some key decisions that you need to get right early on to make sure that you are going to continue this formulation process?
To be honest with you, in formulation, it's all about balance. So early on, we try to find the balance between the ingredients, the balance in the selection of the copolymers, the balance in the different concentrations. So this kind of early choices are what are impacting then after the final product.
At a high level, what does the journey look like from a molecule to a long-acting injectable candidate ready for regulatory development?
So the process is really data-driven. It's iterative. We learn as we go. At each formulation step, at each optimization step, the formulation gets better. It gets closer to what we are expecting in a lead. So all this iterative process converges into one optimal formulation, which we call a lead formulation, which is going to be robust, reproducible, and which we are then ready to give to the first patients.
Okay, so it's kind of the funnel of decision that helps having this
exactly.
regulatory ready.
It's quite a
product.
few rounds where we sometimes go back to the beginning, but everything we invest in the early stages is paying off then in the later stages.
Now, if we speak a bit more about the timeline of all this, what makes long-acting injectables complex or more complex to formulate than traditional medicines?
Yes, I think when you say traditional medicine, you're probably referring to a tablet, let's say. So how a tablet works, by it gets in the body, it gets where it needs to be, and it acts quite quickly, and then it leaves the body quickly. What we are asking from a long-acting injectable is to act like a tiny factory inside the human body and to deliver just the right amount of API every day. And it can be over weeks, it can be over months, even up to a year. This is where the complexity lies and where the difference is with what you call traditional medicine.
With Medincell's BEPO technology, what typically makes a project easier and what tends to complicate things?
So we are lucky that our platform is quite versatile. So many of the problems that occur, we can solve it just by tweaking our copolymers. The second ingredient that we talked about is the drug. What makes the project easy is when we have a good compatibility between the drug and the copolymers. It's quite straightforward. It's not usually the case. So what happens is that either we have a big incompatibility or the physicochemical characteristics of the API itself are quite challenging. But this is where innovation happens.
Now, if we talk a bit more about the timeline, are we talking about months or years of formulation development? How long does it usually take?
So formulation, the word says it itself, are long-acting injectables. It means the duration of the formulation is already quite long. So you can imagine that the development is also going to be long if you want to follow it in real time. So we are talking more about years than months. But what's important to understand that the time that we are putting really in the beginning, it's not lost. It saves a lot of risks and expansion of timelines later on in the process. We divide it in different steps. There is just the first, let's say, assessment step where we are checking, as we discussed earlier, the compatibility. We start early mixing, but then to arrive to the lead formulation, it means that we had quite a few rounds of optimization, and this already before going into clinical can take years.
So from the outside, formulation can feel a little bit technical. Why does it actually matter so much for patients, for doctors, and how can it change the real-world use of a treatment?
So what a good formulation does, it improves the adherence, it reduces the side effects, it makes a treatment easier to integrate in the daily life. It changes in the instance that something that is a daily burden for the patients becomes a monthly solution. And so at Medincell, we strive in providing prototypes which are the best in class, the first in class. It's something that we've done already with UZEDY and olanzapine.
So yes, UZEDY is already on the market. Olanzapine LAI is coming soon. It's amazing to see that thanks to Medincell, we have already long-acting injectables that are on the market, already changing lives of patients living with schizophrenia. What makes Medincell's approach to formulation different from traditional approaches?
Medincell has formulation in the center. It's the heart of the company. Everything else is built around it, so it's not a downstream process. It's really the key to the company. It's formulation and the innovation that goes around it, and I think this is what changes compared to other companies. We have a really strong scientific base, scientific expertise. We have an amazing, really flexible technology. And the part which is missing and which we also have is the people. We have amazing people working in the company. So there is really a collaboration between the teams. And this is what helps us move everything from just an idea to an actual product.
To wrap up this discussion, if you wanted people to remember one key takeaway about formulation at Medincell, what would it be?
Formulation is where innovation becomes reality. It's all about balance to get this recipe just right, and the impact it has, it's enormous. So what we strive is to have better medicine for all.
Formulation may seem a bit technical, but thanks to all your explanation, Emma, we understand it better, and we've seen today that it plays a key role in making treatments more effective, more predictable, and ultimately easier for patients. Thank you so much for sharing all these insights about formulation, Emma.
Thank you so much. It was a real pleasure.
And thank you all for watching. We'll see you soon on Inside Medincell.